What else do we know? And boy, this hit home just last week. Michelle sent me a press release, something in your local newspaper, and the headline was "Meth Babies on the Rise." What does that do to the woman who's using methamphetamine during pregnancy? Is already feeling stigmatized, is feeling shame. You know, there's a difference. Guilt is feeling bad about what you do. Shame is feeling bad about who you are. And when you see something in the newspaper about a meth baby, all that does is drive the woman out of prenatal care. It drives. So one of the ethical issues we'll be talking about is the development of a common language that is referred to as person first. And I know a lot of you have already had discussions about this, but it's going to be very important that we don't talk about cocaine babies. You know, from the 80s, you heard about crack babies. They're children prenatally exposed or prenatally affected by cocaine or by methamphetamine. And the other thing we know is that early intervention works. In fact, extensive research has shown if you do have a child who is prenatally exposed to any of these substances, there are 4 protective factors: being raised in a stable, nurturing home. So now we turn to the child welfare system. How do we ensure that homes are stable and nurturing? No sexual or physical abuse. How do we protect the children? Now, on the healthcare and the social service side, early recognition of risk. How do we recognize the children early and get them into early intervention services? Because what the research shows is if you identify the substance-exposed infant and get them into services before the age of 6 years, you significantly alter the long-term developmental trajectory. What better way to identify the infant early who's at risk than identifying the mother while she's pregnant? And so we'll be talking about the federal legislation around plans of safe care. If we do recognize the child, the pregnant woman who's using, we get her into services and we develop a plan for her and the baby during the prenatal period. And in fact, the new CAPTA, the Federal Child Abuse Prevention and Treatment Act legislation that is due to be passed, it's got bipartisan support. It's due to be passed this spring. It does require prenatal plans of safe care. So Sacramento County is going to be on the front end of fulfilling these federal regulations. What else do we know? We know that infants and toddlers grow, develop, and learn in the context of relationships. And so we're going to talk a lot about the neurobiology of attachment and how substance use during pregnancy can affect the biological systems that drive attachment in the mother and in the infant. We know that good parenting depends on attunement to the baby's inner life. And parents with untreated psychiatric disorders or misusing substances often cannot provide for their infants' physical and emotional needs. That's the truth. Not all of them, but some of them. So how do we start making these decisions about making decisions about the child's placement? And so child welfare is very much a part of this whole picture. Now, very simply, we talk about touch points. And in our program, Sac County Healthy Beginnings, we're going to be looking at key touch points during the prenatal and early childhood years. The first touch point is before the women ever get pregnant. Can we get information, prevention information out there? And we're going to do a whole social media campaign across multiple platforms. Can we get that information out there so women stop using get into treatment, stop using before they ever become pregnant. The second touch point is during the prenatal period with universal screening and assessment, and when needed, brief interventions. So now we've identified the women at highest risk so that when the baby is born, we can identify the baby at birth who has been affected by prenatal substances. And then we have specific touch points for the child and specific touch points for the parents, responding to the needs of each. And that's where systems integration comes in. Integrating systems of care for both maternal and child health. So that's the big picture. And we're not going to get this far in 1 year of starting up this kind of systems work. But what this will do, what this year is, the goals of this year is to educate folks on this, all these issues. The vision for Healthy Beginnings is that we're going to empower families and children to thrive physically, socially, and emotionally, free from the effects of substance use and misuse. Our mission is to promote a healthy and safe environment for Sacramento County's families and children through outreach and education for professionals and community members, addressing perinatal substance use prevention and intervention. And one of Michelle's favorite phrases, I've heard her use it many times, is choose treatment. And that's the message we want to get out there. Embedded in this, of course, is we're going to remove the stigma regarding perinatal substance use through honest and clear communications, through a social media campaign that will be based in science, and we're going to enhance the knowledge of our professionals so that we are delivering the highest level of care.